Primary survey. Step 1, ensure that the scene is safe to approach. Step 2, form a general initial impression of the scene on approach, including the following: the mechanism of injury, the number of patients, resources needed, look at the environment surrounding the patient, and form a general impression of the patient. Look at their age, gender, and weight, the patient positioning, their level of consciousness, whether there's obvious signs of distress, and whether there's presence of any major injuries or bleeding. Step 3, if the patient appears unconscious, do the following: assess responsiveness using the AVPU assessment.
Hello, hello.
Shout or phone for help and get an AED or defibrillator.
Partner, go get my AD.
Assess for a pulse and a breathing effort. Look for absent or abnormal breathing while simultaneously palpating the presence of a pulse. In an adult or child, the carotid pulse, and in an infant, the brachial pulse. If the pulse is present, assess the airway by listening for snoring, gurgling, stridor, or whether the airway is silent. Assess whether the airway is open, clear, maintained, and protected. If the pulse, based on the fact that the pulse is still present, assess breathing, such as the rate, air entry, color, the effort, and the saturation or end-tidal CO2. If the patient appears conscious, assess the airway for snoring, gurgling, stridor, or whether it be silent. Establish whether it's open, clear, maintained, protected. Assess breathing by means of the rate in breaths per minute, the air entry by auscultating for any adventitious sounds and compare bilaterally. The color, if the patient is pink or cyanosed, either peripherally or centrally. The effort of breathing, look for nasal flaring, head bobbing, accessory muscle use, retractions, and grunting. Assess the saturation and end-tidal CO2. Assess circulation by assessing the rate, the beats per minute. Perform the AVPU assessment again.
Hello, sir. Are you awake?
Assess the colour of the patient. Are they pink, cyanosed, pale, or mottled? Establish their in-organ perfusion. Assess capillary refill and strength of their peripheral pulse. Obtain a systolic blood pressure. Assess disability. Assess the pupils in terms of their size, reaction, and compare both left and right. Assess their HTT, assess their GCS, and their posturing. And then lastly, expose the patient and assess for rashes, edema, measure their temperature, and observe for any signs of trauma.